Hello, ladies and gentlemen. Today, our mission is to distinguish between headache and migraine. Sometimes you hear some people saying they've got a migraine, and some other people saying they just have a headache, not a migraine. And then you go to a doctor with some complaints, especially headaches, and then the doctor tells you you've got migraine. And sometimes people get confused. What exactly is the difference? What is a headache? What is a migraine? And what is migraine itself? How do we distinguish between the two? Does it mean that whenever you have a headache, it's a migraine? And what else could it be, if it's not a migraine? So, and each time I do a podcast on headache, either on my own channel or for some other reasons, either for my hospital or for some other channels, I do get asked often to distinguish between a headache and a migraine. And I do try each time to make it as clear as possible. And at the end, I have the sense that maybe I did not succeed in articulating very clearly what exactly is on my mind. But I will try to do my best today so that at the end of this video, you would understand clearly the difference between a headache, a migraine, and then migraine. All right, so first of all, welcome back to the channel Brain Gist, a channel created to educate people about the brain and all the disorders of the nervous system. Appreciate you watching. Please do like, subscribe, share, and leave your comments behind, be it questions, or if you're confused at all by this presentation, just put it in the chat box. Put it in the comment section, and then I will do my best to respond to it. All right. So it's not exactly very easy to put it out very clearly what the difference is, but I'll do my best. All right. So everybody watching this video has had a headache at one point or the other. So a headache is just pain in the head. So nobody needs any explanation about what a headache is. Now, what then is a migraine? So I will move from what we already know and then slowly move into the unknown. So now from a headache, now we'll move on to a migraine. So a migraine is a type of headache which is usually one-sided, and it usually throbs or pulsates. The people who experience it will usually describe it as a pulsing headache or a pounding headache, all right, or a throbbing headache. And it would usually last for several hours. And usually while this headache is occurring, such individuals will experience some sort of sensitivity to light, to noise, and sometimes even to smell, and they may actually feel like vomiting. So these are some of the classical things that characterize the type of headache that is described as a migraine. So mind the word a migraine. So I'm using the article a behind migraine in this case. So like an indefinite article, a migraine. Now we'll move to the next one, and that's migraine without the article. For the purpose of this presentation, I've chosen to, define these three entities: headache, a migraine, and then migraine. Now you understand headache and a migraine. So the third one is migraine. So when we use the word migraine as neurologists or headache experts, we refer to a condition. Just like you would say somebody has got tuberculosis, or hypertension, or somebody has got obesity. These are conditions, standard conditions. You expect that somebody who has obesity would be bigger or huger than they should be. You expect somebody who has hypertension to have a higher blood pressure than others. So these are conditions, these are diagnostic entities that you would go to a doctor and get that diagnosis, that that's what you have. So migraine is a diagnosis. And that's the third entity we're defining today. It is a condition, it is a disorder. And we've defined this in my earliest videos. We've tried to explain what it is. So someone with migraine as a disorder now actually has a tendency or an inherent or genetically determined tendency to get headaches. So now a person who has migraine would have, by definition, a lot of headaches, even when nothing is wrong with them. And a good proportion of their headaches would have the features that qualify to be described as a migraine. But not all of their headaches would fulfill that criteria for a migraine, like I described earlier. So all the features I described earlier that make up what we call a migraine. So not all headaches suffered by somebody who has migraine would fit the definition of a migraine. Some of the headaches would be just pressure-like, or would be on both sides of the head, or would just be aching, or just throbbing without all the other accompanying features. And so those who have migraine, a lot of them would tell you that they had, for example, let's say they had 10 headaches in a month under review. And of these 10 headaches, 5 of them were migraines, whereas the other 5 were not. So in that context, they're describing the nature or the phenotype or the behavior of the headache. So this is how we play around with these terms. So at the end of the day, you will now realize that somebody by definition who has migraine as a diagnosis would certainly get headaches. All right? And then somebody who has headaches may not necessarily have migraine. So migraine is a diagnosis. And somebody who's been diagnosed with migraine by definition will get a lot of headaches, some of which will be typical migraines, and some of which would not be typical migraines. So I do hope it's now clear. So headaches are not always caused by migraine as a diagnosis. There are many other causes for headaches. But somebody who has migraine will certainly present with headaches. And not all headaches due to migraine are migrainous or would look like a migraine. So some people get confused when they come to the clinic and they say, "Doctor, I've been having this headache in the front of my head for the past 2 weeks and it's been going on non-stop." And at the end, after taking a history of that headache and their overall health history and examining them and looking at their labs and or MRIs, we make a conclusion and say, "Madam or sir, what you have is migraine." And they say, no, I don't have migraine, because those who have migraine, I know how they present. They have this, they have that, they have that. So what we now explain to them that it is not all the headaches that a migraine sufferer has that would actually behave like migraine. So somebody with migraine as a diagnosis will certainly at some point have headaches that would sound, look, and appear like migraines, but they would also have other headaches that do not look or sound like migraine. Now the confusion for us as doctors, or shall I not say confusion, shall I say the complexity, comes when somebody who is known to have migraine as a diagnosis comes to the emergency room with a headache that is not caused by migraine. So a lot of times our first instinct as doctors is to say, oh, this person is a known migraine sufferer, so very likely this headache is migraine, and it may be something else. Sometimes it's even life-threatening. So it's a serious job on our hands when we see people who are known to have migraine coming with headaches. We need to really tune our antennas to make sure we don't miss, a different cause of headache in such individuals, because the fact that somebody has migraine, which would be the cause of most of their headaches, doesn't exempt them from having other conditions that can cause headache. I do hope I did not confuse you with this video. I do hope you learned something. If you did and it's clear, please just comment clear at the end. And in case you're confused, you can leave your questions at the end. I will try to explain. You can leave your questions in the comment section. I'll try to respond to every one of them. Thank you so much for watching today, and I hope to see you again next time. Bye for now.